Before treating vitiligo, one needs to understand why one got the vitiligo. Without reason, no one will get the vitiligo. So one of the reason is the cell which gives color to the skin, we call it as MelanoSite, is weak. It cannot tolerate certain toxins. Mostly it is free radical. Free radicals increase because of the lifestyle, diet, environmental factors, too much of winter, too much of summer. These can damage the skin, increase the free radical, and also free radicals increase because of the stress. Then there will be some blood parameters which are deranged, either they are deficient or increased levels. They can increase the free radical. This can be deficiency in the vitamins or thyroid derangements, cholesterol problems like dyslipidemia. These problems we need to detect. These actually increase the free radical. This free radical actually damage the sensitive melanocytes, and then the immune system of patients will attack the melanocyte. This is called autoimmunity, where your own immune system attacking against your cells. Basically it is under control of vitamin D. So suppose your vitamin D is lower, so the autoimmunity will be severe. So I have to understand these things and analyze. Then based on this we have to have the strategy. First we will focus on stopping the disease from within. Then we try to get the pigmentation with the medical management and the phototherapy. Then if it is not responsive and medicines not giving the satisfactory result and patient is having stable vitiligo, once we understand why the vitiligo happened because of the increase in the toxins or kind of thing, we have to strategize how to go about in treating the vitiligo. Initially we will focus on stabilizing the vitiligo with medical management. Then we focus on like getting the pigmentation with medical management as well as phototherapy. Suppose if this method fails and there is not much of improvement happening with the medical management, we have to analyze whether vitiligo is stable for a longer time. Then we can go for surgical management, especially the cell transplantation techniques. However, there is one intervention which is very important, and patient's role is very important in this intervention. It starts from the day one. It is basically maintenance, where patient's lifestyle, diet, then their skin care, all these parameters will come. So especially we advise patients to have a healthy lifestyle, no alcohol, no smoking kind of lifestyle. They have to have sound sleep. 6 to 8 hours of sound sleep is sufficient. Then they have to exercise. Physical activity is very important. Simple cardio exercise for 60 to 90 minutes depending on the age is sufficient. You need not go for gym or kind of thing. You can simply do the cardio exercise like simple brisk walking kind of thing. And next is like diet. In diet we don't give any diet chart or kind of thing. There is no rule that you have to avoid certain food stuff or you have to take some food stuff in a higher quantity. It is not like that. You have to follow balanced and everything in moderation kind of rule. We give some advices, like one needs to take early dinner, light dinner, reduce the oily food, reduce the sweet, reduce the salt, more of fibers like green leafy vegetables, and you have to reduce your carbohydrate a bit, like your roti, chapati, especially wheat, and the rice you have to reduce. I am not telling it to stop, you have to reduce it. Then your skin care, which is very important. You have to use sunscreen and moisturizer as advised. Especially in winter months you have to use frequently moisturization, because dry skin itching might give rise to vitiligo. Then sunscreen also important, both in winter as well as summer. In summer months you have to increase the frequency. Too much of sun can also increase the vitiligo if it is in active stage. So these two methods, moisturizer and sunscreen, play a prophylactic or preventive role. Then we suggest patient to not to use plastic and rubber footwear, because the allergy to plastic and rubber can increase the vitiligo. And also patients who are using hair dyes should not use hair dyes containing chemical called PPD, paraphenolphthalein diamide, which tend to increase the vitiligo. Then you should avoid wearing tight cloths and tight footwears, wherever the tightness happens, you tend to get more vitiligo patches. One of the important step in vitiligo fight is stress management. We are not telling that you can't take stress, avoid stress. Stress are unavoidable, but you have to manage the stress. How stress increases vitiligo? Stress usually increases the toxin free radical. That free radical will increase your vitiligo. Vitiligo naturally increases your stress, then in turn vitiligo will increase. It's like a vicious cycle. So here my job is like guiding you, showing the direction, but it is your role, your efforts, your involvement is going to get the pigmentation. My role is only 20%, my clinic's role is only 20%, your role is 80%. How much efforts, involvement you put, you are going to get that much of results. And final thing is like attitude management. You have to be positive. From here you have to think that you will get rid of the vitiligo. Being negative tend to increase the toxins, and your treatment may not give desirable result. Another important thing is being realistic. Realistic expectations. You cannot be unrealistic, unreasonable. Realistic means I cannot do magic like this. You cannot get result like quick results. So there will be stepwise approach we have to go, and result will be like that. And some of the time vitiligo may not behave as we expect. There will be changes, there will be relapses, there will be good response. Sometimes there will be no response, and all of a sudden vitiligo can worsen. My job is to analyze this and act accordingly and change my treatment and get the best result out of the treatment. And you have to trust the treatment you are following or the clinic you are taking the treatment. Without trust, the result cannot be good. The main thing is like you cannot have excuses. Excuse means you are busy, you cannot do that, you cannot do this. Your vitiligo don't understand these things. It needs what it needs. So when we treat any vitiligo, there are two kinds of difficulties we face. One is called difficult to treat vitiligo. It is related to vitiligo, multiple patches, some underlying problem, long-standing vitiligo. So all these difficult sites and all those things, but eventually we can treat any vitiligo. There is no difficulty as such. But the biggest problem is difficult to treat patient, what it means. So patient who doesn't listen what they need to understand and they need to listen, patient don't do what they need to do. So they are considered as difficult to treat patient. If you are simple manageable patient, any difficult vitiligo can be managed. If you are difficult patient, you don't follow the instructions properly, then even the simplest vitiligo cannot be treated successfully.